Well, we've been colleagues for many years, particularly, I would say, starting back in the mid-90s. Dr. Meakins, during that time, was chairman of the Department of Surgery.
As someone who's worked in the Department of Surgery for over 40 years, I had a long time working side by side with Dr. Meakins in his various roles.
Medicine came later. As you know, my grandfather and father were doctors, so there was always that hidden pressure to think about medicine as a career.
He was a wonderful surgeon scientist and a real leader in the field of surgical infection, understanding what caused people to have infections after surgery and the impact infections had on their recovery after surgery.
We knew about a drug that was supposed to be immunomodulatory, that modulate the immune system, and dealt specifically with this skin test reaction. And so we set up a clinical trial that was randomized and double-blind, which showed the efficacy of the immunomodulator. And when that was published, it's in a way set off a train of activity in the surgical world to think about identifying patients who were at risk of infection rather than simply operating on patients to solve whatever their problem happened to be.
And he and I worked on a number of projects together in the department and the faculty, and more particularly in the development of the simulation center for both surgical and medical skills, and now a facility that serves literally hundreds of students in the Faculty of Medicine.
Around the time that this kind of crystallized in my mind, I was in Toronto where they had a simulation lab run by Richard Resnick. And it just seemed so obvious. It eliminated learning how to do some of this stuff in people, which I thought was important.
So Dr. Meakins is not a unidimensional person. He's a Renaissance man, and he and his wife Jackie have put together a remarkable collection of art, which they've donated to the Canadian Museum of Art. He's a wonderful chef. You should taste his foie gras. It's really outstanding. He's an enthusiastic golfer, and I could tell you personally, he's a very competitive tennis player. He is a beekeeper. Really, there's a lot to him. He's a lover of music, and he's a really well-rounded individual.
The goal of the Art and Heritage Center for the McGill University Health Center is to create a healing environment. That includes taking care, preserving our medical, historical, social histories, as well as its art collection. It was his leadership, his vision of what could be that really brought us to where we are today. He is very open, forward-thinking, and but is also patient and thoughtful. His leadership is always there, but never imposing.
He really made us think very critically about the way we deliver care, the rigor of measuring what we do, and the importance of creating new knowledge and innovations to constantly improve the medical care that we deliver. Probably more than anything was a role model and a mentor for me to take on leadership roles and to understand that leadership is more than just a title, but it's an opportunity to really implement change.
Pioneer and innovator in the immunology of surgical infections and prolific mentor to generations of health researchers, Canadian Medical Hall of Fame laureate, Dr. Jonathan Meakins.